Hello, Medicos. Good day to all of you. This is Dr. BK for you, and today I will be discussing about the submandibular gland, which is situated in the submandibular region. So, in addition to the submandibular gland, I will also be discussing about its associated structure, that is the submandibular ganglion, followed by that Hyoglossus muscle and the lingual artery. So, our learning objectives for today with respect to the submandibular gland will be mainly on a short introduction, followed by that situation, coverings of the gland, then its presenting parts, relations, blood supply, nerve supply, and then the clinical aspects. So, and followed by that, with respect to the submandibular gland, I will be discussing mainly its situation, connections, and the distribution. Now, first of all, where actually the submandibular gland is situated? So, it is actually situated in the submandibular region. Okay. The submandibular region extends from the mandible to the hyoid bone. So, now deep to the body of the mandible also you have a fossa which is called as the submandibular fossa, which partly accommodates the submandibular gland. Okay. So, that is from the lower border to the mylohyoid line of the mandible, which is present deeply. You can see the gland is actually very intimately related to the mandible. So, up to this submandibular fossa and to the hyoid bone, it is actually called as the submandibular region. Okay. So, this submandibular gland is one of the salivary glands, major salivary glands, because we also have numerous small lingual glands. Okay. So, the largest is the parotid gland, which we have already discussed. Today, we will be discussing about the submandibular and the sublingual salivary glands. Okay. Now, while I was actually discussing about the submandibular region, actually it is also a part of the digastric triangle. But digastric triangle, we actually include more posteriorly certain structures and all that which comes between the two bellies of the digastric muscle. But in the same way, the submandibular region also mainly consists of your submandibular salivary gland. Okay, and then other important structures which are present in this region is, apart from the submandibular salivary gland, you have the suprahyoid muscles. Mainly, you should try to understand these two muscles, which can also be considered, which forms the bed of the submandibular salivary gland. One is the mylohyoid muscle. This muscle we have discussed extensively in the submental triangle. Okay. The next muscle of the submandibular region is, which is almost right angles to that, is the Hyoglossus muscle. Okay. So, this muscle is also called as the key muscle of the submandibular region. So, suprahyoid muscles, you have mainly the mylohyoid muscle, then you have the digastric and geniohyoid muscles also. So, in the submandibular region, apart from that, you are seeing the Hyoglossus muscle, which is the muscle, extrinsic muscle of the tongue. So, you come across Hyoglossus part of, then you also come across Hyoglossus and genioglossus muscle. Okay. Then what else you come across? Apart from that, mainly blood vessels, you see the facial artery in the submandibular region and also intimately related to the submandibular salivary gland. And in a more deeper aspect, you will actually come across the lingual artery. So, apart from the submandibular gland and the muscles, you come across the extrinsic muscles of tongue, and then, as I told you, the facial artery and the lingual artery. Then the 12th cranial nerve or the hypoglossal nerve is also seen in the submandibular region. Okay, and then superficially you also have the submandibular lymph nodes, because submandibular lymph nodes is very essential because it drains a wide structures. Okay, so that is the situated on top of the submandibular gland is the submandibular lymph nodes. So they mainly drain the submandibular region, sides of the tongue, and they also drain your lateral part of your cheek, lateral part of your nose, inner part of your eye, central part of your forehead, and your maxillary air sinus. Now, coming to the submandibular salivary gland, I told you it is a walnut shaped gland, 10 to 15 grams in weight. Okay, and it lodges in the submandibular fossa, which extends on the deeper surface of the body of the mandible from the lower border up to the mylohyoid line. So that is where the mylohyoid muscle originates. You are able to see that is the mylohyoid muscle. Now, the fossa extends from the base of mandible to the mylohyoid line. Coverings mainly are true capsule and the false capsule. So the true capsule mainly, actually it is the fibrous condensation of the gland. Okay, the false capsule is the investing layer of deep cervical fascia. Okay, so the investing layer is the most superficial layer of the deep cervical fascia. It is immediately seen below the platysma muscle. The platysma is cut and reflected, so you are able to see the deep cervical fascia. So it encloses the sternocleidomastoid and then the trapezius muscle. And you are able to see here it is forming the roof of the posterior triangle. Now this investing layer of deep cervical fascia, it actually passes above to get inserted into the lower border of the body of the mandible. Okay, at the region of the submandibular gland, what happens? The fascia splits to enclose the gland. Okay, so thereby when it splits, it will cover the inferior surface, and then when it goes deeper, naturally it will cover the medial surface, because the lateral surface of the gland is intimately related to the submandibular fossa of the mandible. So after attaching to the split, after when it reaches the lower part of the gland, the deep cervical fascia splits to get attached to the lower border of the body of the mandible here, and then the one more deep layer which has split gets attached to the mylohyoid line of the mandible, from where the mylohyoid muscle originates. Okay, so that is how it splits to enclose. So now it is actually the gland is covering the inferior surface, as you are seeing, and the medial surface, superficial part especially, but not the lateral surface, because the lateral surface is in close contact with the mandible. That is the splitting of the deep cervical fascia, investing layer of the deep cervical fascia. Okay, now coming to the parts, mainly the submandibular gland has got a large superficial part, okay, and a deep part. Now both the parts are continuous around this posterior border of the mylohyoid muscle. Okay, so that means it is the mylohyoid muscle which divides the submandibular gland into a large superficial part and a small deep part, and both the parts are continuous around the posterior border of the mylohyoid muscle. So now we will actually first start to discuss with the superficial part of the gland. So it consists of three surfaces and two ends. So the two ends should be the anterior end and the posterior end. Three surfaces, already I told you, the inferior surface, then you have the medial surface, and then the lateral surface. So The anterior end actually extends up to the anterior belly of digastric. Okay, whereas the posterior end is actually related to the stylomandibular ligament, which extends from the styloid process to the angle of mandible, which separates the parotid gland from the submandibular salivary gland. And that stylomandibular ligament is the modification of the again investing layer of deep cervical fascia. So here you are able to see a section at the submandibular region shows the mylohyoid muscle, the superficial part which is above the muscle, and the deep part which is deep to the mylohyoid muscle. Now both the parts, the superficial part and the deep part, are continuous along the posterior border of the mylohyoid muscle. So the anterior end extends up to the anterior belly of digastric. Posterior end will be related to the stylomandibular ligament. Okay. And it is more intimately related to the loop of the facial artery. The posterior end will be grooved by the ascending limb of the facial artery. So I will come to it later. Now, first let us discuss about the inferior surface. So the inferior surface is what you can palpable as a mass below the lower border of the mandible in the submandibular region. So the inferior surface is mainly related to skin, superficial fascia, platysma, and investing layer of deep cervical fascia. Okay. So deep to platysma, you can see the facial nerve, the facial common facial vein which is crossing and getting drained into the internal jugular vein, and it is also crossed by the cervical branch of facial nerve. Okay, the facial vein crosses the gland, and also you can see the cervical branch of facial nerve. Both are present deep to the platysma. So the relations of the inferior surface will be skin, superficial fascia, platysma muscle, facial vein, cervical branch of facial nerve, and then investing layer of deep cervical fascia. Then one more structure also you see on this surface is the submandibular lymph nodes. Okay, so these are the relations of the inferior surface of the superficial part of the gland. Okay, so now next coming to the lateral surface. Now before that, you are able to see the posterior end of the superficial surface is actually grooved by the facial artery. So the ascending limb of the facial artery is actually makes a groove on the posterior end of the superficial part of the submandibular gland. Now we will come to the lateral surface. So the lateral surface is intimately related to the submandibular fossa of the mandible. Okay, so it is mainly related to the submandibular fossa, which extends here up till the mylohyoid line. Then between the bone and the gland, again you can see the U-shaped loop of the facial artery. Okay, so then more posteriorly you will also see the, because here you have the angle of mandible. So what is actually attached to the medial surface of angle of mandible is the medial pterygoid muscle. Okay, so the facial artery loops between the bone and the gland, which forms an intimate relation with the gland. So then afterwards the facial artery will pierce the deep cervical fascia, and it will enter the face at the antero-inferior angle of the masseter, which is seen on the lateral or superficial surface of the ramus of mandible. So medial surface mainly related to submandibular fossa of the mandible and the facial artery, and more posteriorly you will have the insertion of the medial pterygoid muscle. So we have actually discussed about the inferior surface and the lateral surface. Now we will come to the medial surface. The medial surface is extensive and is divided into three parts: anterior part, intermediate part and then the posterior part. Now the relations of the anterior part mainly, so medial surface which is resting on the mylohyoid muscle. Okay, so it is related to mylohyoid muscle and the nerve and artery supplying the muscles, that is the mylohyoid vessels and the nerves. Mylohyoid nerve is a branch of inferior alveolar nerve. So here you are able to see the inferior alveolar nerve before the nerve enters the mandibular foramen. So the mandible has been removed. Before the nerve enters the mandibular foramen, it gives a branch which is called as the mylohyoid nerve. So that is actually related to the medial surface of the superficial part of the gland. So between the mylohyoid muscle and the gland, you see the mylohyoid vessels and nerves. So mylohyoid nerve, mylohyoid artery is again a branch of inferior alveolar artery. Then anteriorly you will also come across submental vessels. Okay, submental vessel is again a branch of the facial artery. So anterior part is related to the mylohyoid muscle, medial surface and mylohyoid vessels and the nerves. Next, coming to the intermediate part. So here you are able to see, so that is the medial surface which is in close contact with the mylohyoid muscle. So between the gland and the muscle you will have the mylohyoid vessels and nerves. Now coming to the intermediate medial surface, intermediate part is mainly related to this muscle which you are seeing here is the Hyoglossus muscle. Okay, then apart from the Hyoglossus muscle, it will be related to the submandibular ganglion and the lingual nerve. Okay, so that is the lingual nerve you are able to see above the gland. So the lingual nerve is again a branch of the posterior division of the mandibular nerve. So lingual nerve and then the submandibular ganglion, because the ganglion itself is suspended from the lingual nerve by two roots, anterior root and the posterior root. So intermediate part is related to the hyoglossus muscle, lingual nerve, submandibular ganglion, and one more structure which will be passing on the lower part of the muscle is the hypoglossal nerve. Posterior part, here the posterior part will be related to the styloglossus muscle. So mainly it will be related to the styloglossus muscle and then the glossopharyngeal nerve. Okay, styloglossus muscle and the glossopharyngeal nerve and the stylopharyngeus muscle. Styloglossus, glossopharyngeal nerve, stylopharyngeus muscle. Coming to the deep part. So the deep part is actually lying on top of this hyoglossus muscle. It is deep to the posterior part of mylohyoid. So the deep part is actually present between the mylohyoid and the hyoglossus muscle. Okay, so that is what, and mainly the relations is laterally the mylohyoid. So the mylohyoid forms the lateral relation for the deep part and medial relation for the medial surface of the superficial part, and both the parts are actually continuous around the posterior border of the mylohyoid muscle. Okay, so laterally you are able to see mainly the mylohyoid. Medially it will be related to the hyoglossus muscle. Then anteriorly what happens is it will reach the posterior end of the sublingual salivary gland. Okay, and then above it is related to the lingual nerve and the submandibular ganglion. Okay, then it is related to the lingual nerve and the submandibular ganglion. Below, okay, so that is the superior relation, hypoglossal nerve. So now the ganglion, now the gland is removed. So here you will see the deep part of the gland. It was resting on the hyoglossus muscle. Okay, and above it is related to the lingual nerve and the submandibular ganglion. Below it is related to the hypoglossal nerve, and one peculiarity of the hypoglossal nerve is it is accompanied by a pair of veins, that is the venae commitants. Usually arteries are venae commitants, but here what happens is the nerve is accompanied by a pair of veins. So hypoglossal nerve and the venae commitants. Okay, So here you are able to see the styloglossus muscle, and that is the stylopharyngeus muscle with the glossopharyngeal nerve. So stylopharyngeus muscle with the glossopharyngeal nerve, and that is the styloglossus muscle. Okay, so inferior relations, superior, inferior. Anteriorly, I told you it is actually related to the posterior end of the sublingual gland. Now coming to the submandibular duct. So the submandibular duct is also called as the Wharton's duct, which is approximately 5 centimeters in length. Okay. The parotid gland duct is actually called as the Stenson's duct. Now, the Wharton's duct mainly starts from the deep surface of the superficial part of the gland. So here you are able to see the large superficial surface, medial deep surface, no, superficial part, deep surface. From the deep surface, the submandibular duct starts, and it first passes upwards, okay, and forwards, okay, sorry, upwards and backwards. Then it runs upwards and forwards, and then finally what happens is opens into the sublingual papillae at the floor of the mouth. On either side of the tongue you can see a raised, this one which is called as the sublingual papillae, the summit. So that is the submandibular duct, again, which you are able to see in the lateral view. First it runs upwards and backwards, then forwards, and then finally what happens, it opens into the floor of the mouth at the sublingual papillae. Now the duct has a triple relation with the lingual nerve. The lingual nerve is actually first, you are able to see that it is above the duct. The lingual nerve is above the duct, then crosses the duct laterally, and finally what happens, it passes medial to the duct. So it is going deep to the duct, and then the lingual nerve will actually divide into many branches to supply the anterior 2/3 of the tongue. Okay, so that is the triple relation. First it is above, then it crosses laterally, and finally it passes medial to the duct. That is the relationship with the duct and the lingual nerve. So blood supply, it is mainly by branches from the facial artery and the lingual artery. Okay, so veins corresponding to this artery mainly drain into the common facial vein or the internal jugular vein. Lymphatic drainage is mainly from the submandibular lymph nodes. Then these nodes drain into the jugulo-digastric nodes. Okay, so lymphatics mainly submandibular nodes. Efferents from these nodes, they pass to the jugulo-digastric nodes. Next, coming to the nerve supply. So the nerve supply, since it is a gland, it has got a secretory action. So mainly secretomotor nerves they supply, mainly the parasympathetic nerves. And you also have sympathetic, which is vasomotor. Now not only vasomotor, the sympathetic is also believed to be secretory in nature. That is, parasympathetic will produce watery secretions, whereas sympathetic will produce mucus-like secretions, because the gland itself is a mixed gland, but predominantly serous, but you also have mucus acini, which produces mucus secretions. They are mostly viscous, the mucus type of secretions are. So both are actually, that is why secretomotor, and apart from that sympathetic is vasomotor to the blood vessels supplying the gland. Okay, so parasympathetic is mainly from the submandibular ganglion. So preganglionic fibers from the cauda tympani nerve join the lingual nerve and then relay in the ganglion. Postganglionic fibers actually travel via the lingual nerve, and then what happens is they supply the submandibular and the sublingual salivary gland. Okay, sympathetic fibers, as I told you, from superior cervical ganglion pass via the facial artery, and they are partly secretomotor and they are also vasomotor to the blood vessels supplying the gland. So we will also have a short description about the sublingual gland. So this sublingual gland is also situated in the sublingual fossa below the floor of the mouth. That is why below the tongue it is called a sublingual fossa. It is deep to the mylohyoid. Okay, and floor of the mouth, if you look at it, the mucous membrane covers it. So deep to the mucous membrane, you can see the small almond-shaped gland. Okay, so smallest of the salivary glands. So that is the sublingual salivary gland. So the anterior end will meet the gland of the opposite side, and the posterior end is actually related to the deep part of the submandibular gland. Okay, so anteriorly meets the fellow of the opposite side and posteriorly related to the deep part of the submandibular gland, and below it is related to the mylohyoid muscle. Below it is related to the mylohyoid muscle. So that is the mylohyoid muscle which you are seeing here. Above it will be covered by the mucous membrane of the floor of the mouth. Okay, the mucous membrane of the floor of the mouth forms a fold at the region of the sublingual gland called as the sublingual fold, and that is the mylohyoid line of the mandible from which the mylohyoid nerve originates. Okay, so above mucous membrane forming the sublingual fold, below it is related to the mylohyoid muscle, and laterally it is actually related to the mandible, that is the sublingual fossa, same like the submandibular fossa where the submandibular gland is related, the lateral surface of the superficial part. So here you are able to see the sublingual gland, and it is mainly related anteriorly to meet the fellow of the opposite side, posteriorly related to the deep part of the gland, and below you have the mylohyoid muscle. And this should be your medially the genioglossus, which forms the bulk of the tongue. So medially it is resting on top of the genioglossus muscle. This is the extrinsic muscle of the tongue. So coming to the duct of the gland, there are mainly numerous small 10 to 20 ducts. So the ravenous ducts, they are called as ducts of ravenous, open directly into the floor of the mouth. But 4 to 5 ducts, they unite and they might join the sublingual duct. Some ducts unite to form a single duct and joins the submandibular duct. So blood supply is again by sublingual and submental arteries, lymphatics, same as submandibular gland, submandibular and submental lymph nodes, and nerve supply is by the submandibular ganglion. Okay. So clinical aspects, mainly enlargement of the submandibular gland. So it may be an obstruction of the duct or by a tumor of the gland, can be actually examined by a bimanual examination. So one finger is actually placed in the floor of the mouth, inside the mouth, floor of the mouth. The other is placed externally below the mandible. Then on both sides you will be able to feel a soft mass which is the submandibular gland. So by that you can confirm that the mass is because of the enlargement of the submandibular gland. Now if you are not able to palpate in the floor of the mouth internally but only outside in the submandibular region below the mandible, then it should be due to enlargement of the submandibular nodes. So with this we can actually confirm whether it is the enlargement of the nodes or the submandibular gland. So cystic swelling of the sublingual gland is actually called as ranula. It is again due to obstruction of the sublingual gland. So to see the obstruction, whether there is an obstruction in the duct system, mainly we go for a procedure, diagnostic procedure, which is called as xylography. So a contrast is actually introduced and then you visualize with the radiograph. Okay, this is actually the method to visualize the ducts of the salivary glands. So we will come to the submandibular ganglion. Again, this is one of the peripheral parasympathetic ganglion. So 4 ganglions I have discussed in the head and neck. peripheral parasympathetic. The first one was the ciliary ganglion in the orbit. The second one was the aortic ganglion. The second one was the aortic ganglion in the infratemporal fossa. Then in the last class I have discussed about the pterygopalatine ganglion in the pterygopalatine fossa. The fourth one, the peripheral parasympathetic ganglion, is the submandibular ganglion, situated in the submandibular region on top of the hyoglossus muscle. It is secretomotor to the submandibular and sublingual salivary glands. Now, any gland you take after the situation, you should definitely comment whether structurally it is related to the lingual nerve and functionally related to the cauda tympani nerve. So, structurally, all the four peripheral parasympathetic ganglion, they are related to one or the other branch of the trigeminal nerve. Now, lingual nerve, you are able to see submandibular ganglion. Okay, the aortic ganglion, it is related to the trunk of the mandibular nerve or nerve to medial pterygoid. The ciliary ganglion is actually structurally related to the nasociliary nerve. Okay, whereas the pterygopalatine ganglion is related to the trunk of the maxillary nerve. So all are mainly related to one or the other branches of the trigeminal nerve, fifth cranial nerve. Whereas functionally, aortic ganglion is related to glossopharyngeal nerve. Pterygopalatine and submandibular is related to the facial nerve, and the ciliary ganglion is related to the oculomotor nerve. Okay, so functionally it is mainly related to the cauda tympani branch of the facial nerve. So from where actually it arises? Okay, so I told you situation is on top of the hyoglossus muscle in the submandibular region, and it is suspended from the lingual nerve by two roots, anterior and posterior root. Okay, so don't confuse these roots with the root or the which is actually entering the gland, that is the sympathetic and the parasympathetic. Okay, so sympathetic and the parasympathetic is different. Those roots you have, these are nothing but the structural roots which are suspending anterior and posterior root. Don't confuse that with the sympathetic and the parasympathetic root. So now let's trace the submandibular ganglion. The nucleus actually is from the superior salivatory nucleus. So the fibers arise from the superior salivatory nucleus and they pass via the facial nerve. Okay, then from the facial nerve, what happens is the branch of the facial nerve is the cauda tympani nerve. Okay, so the branch of the facial nerve is the cauda tympani nerve. Facial nerve is actually emerging via the stylomastoid foramen. So in the middle ear, within the facial canal, the facial nerve gives a branch that is called as the cauda tympani nerve. Same way, this is the bend of the facial nerve, genu, which has a ganglion called as the geniculate ganglion. From that, the greater petrosal nerve is given. This is your cauda tympani nerve, which has a course within the middle ear cavity and is intimately related to the tympanic membrane and the handle of malleus. Then it comes out through the petrotympanic fissure and then joins the lingual nerve at an acute angle in the infratemporal fossa. Okay, so that course we have already seen in the mandibular nerve. In the infratemporal fossa, it joins the lingual nerve. Then the cauda tympanic nerve, after joining the lingual nerve, so the fibers pass via the lingual nerve and they relay in the ganglion. Okay, they relay in the submandibular ganglion mainly through the posterior root. Two roots are there which is suspending the ganglion. After relaying in the ganglion, post-ganglionic fibers travel via the lingual nerve or from the branches of the ganglion and then through the anterior root. Okay, post-ganglionic fibers, then they will supply your submandibular and the sublingual salivary glands. So that is the parasympathetic pathway. Coming to the sympathetic pathway, mainly it arises from the upper thoracic T1 to T2 segments of the spinal cord, the preganglionic fibers, Then they relay or bypass the inferior and middle, and they relay in the superior cervical ganglion. Okay, so the superior cervical ganglion is the relay station of the most of the sympathetic fibers. So post-ganglionic sympathetic fibers from the superior cervical ganglion will pass via the sympathetic plexus. So that is the common carotid, external carotid, and finally what happens through the plexus around the facial artery. So it passes through the plexus around the facial artery and then passes through the submandibular ganglion but without relay. They just bypass the ganglion and gives vasomotor fibers to the submandibular and sublingual salivary gland. So the sensory roots, so it has a motor component, that is the parasympathetic component. Then it has got the sympathetic component, any ganglion which we considered, and then you have the sensory root. They are branches from the lingual nerve. They also don't relay in the ganglion, 5 to 6 branches. They just bypass and then supply the submandibular gland through the lingual nerve. Okay, so that is about the submandibular salivary gland. So next we are going to discuss about this muscle, the Hyoglossus muscle. So it is actually a quadrilateral muscle, and it is the extrinsic muscle of the tongue. Okay, which mainly alters the shape and position of the tongue. So many muscles are there. They all will be ending glossus, glossus, glossus. Hyoglossus, styloglossus, palatoglossus, genioglossus. Okay. So this muscle is also called as the key muscle of the submandibular region because so many structures are present on top of it, and it divides the structures into superficial and deep. And not only that, it also divides the lingual artery into 3 parts. So most of the key muscles which we have discussed in the earlier classes, the key muscles, mainly the lateral pterygoid, divides the maxillary artery into 3 parts. Okay, same way we have the pectoralis minor dividing the axillary artery into 3 parts. The scalenus anterior dividing the subclavian artery into 3 parts. Okay, so in this the key muscle is the Hyoglossus muscle, which we are seeing here, extrinsic muscle of the tongue. So origin from the greater horn of the hyoid bone and also from the adjacent part of the body of the hyoid bone. So the fibers pass upwards and forwards and gets inserted into the side of the tongue. Okay, inserted the side of the tongue between the styloglossus laterally and more medially. You will see the inferior longitudinal linguae. They are intrinsic muscle of the tongue. They are present within the tongue itself. You cannot see outside. Okay, so the inferior longitudinal linguae muscle. Laterally, it is the styloglossus muscle. So between the styloglossus and inferior longitudinal linguae, it gets inserted. The main action is when the muscle contracts, it makes the dorsal surface convex. Okay, it makes the dorsal surface convex, and it also retracts, pulls back the tongue. That is the protruded tongue. Okay, so it also pulls back the protruded tongue. Sometimes a part of the hyoglossus might originate from the lesser horn of hyoid bone, and that is called as the chondroglossus. Okay, so coming to the relations, so above on top of the hyoglossus, mainly you come across the lingual nerve, submandibular ganglion. Then you will see the deep part of the submandibular gland. Then you will see the hypoglossal nerve with the venae commitans. Okay, so lingual nerve with 2 roots and submandibular ganglion, then submandibular ganglion itself, then submandibular gland, which is not shown in this picture, and below you are able to see the hypoglossal nerve with its pair of veins. Then the anterior part of the muscle will be overlapped by the mylohyoid muscle. Again, that has been removed so that we get a clearer view of the hyoglossus muscle. Deep relation. So what are present deep to the gland? So mainly you come across the genioglossus muscle, which is present deep to the gland. So now the hyoglossus muscle is cut. You see the genioglossus, And then what you come across is the middle constrictor muscle of the pharynx. Okay, so mainly you come across the genioglossus, which forms the bulk of the tongue. This is geniohyoid, whereas these fibers are genioglossus. Then, as I told you, it mainly consists of the middle constrictor and inferior longitudinal linguae muscle. Okay, glossopharyngeal nerve. Okay, with the stylopharyngeus muscle. Glossopharyngeal nerve with the stylopharyngeus muscle and the stylohyoid ligament. So here you are able to see the stylohyoid ligament, and that is the stylopharyngeus muscle which is entering the pharynx. That will go along with the glossopharyngeal nerve. Then you also see the lingual artery, the second part of the lingual artery. All are deep to the hyoglossus muscle. So part of the hyoglossus has been removed. So you see the medially genioglossus, middle constrictor. Then you come across the stylohyoid ligament, stylopharyngeus with the glossopharyngeal nerve and the lingual artery. Okay, those are the deep relations of the hyoglossus muscle. So here you are able to see the stylopharyngeus with the glossopharyngeal nerve. So posterior border. So deep to the posterior border, you come across the glossopharyngeal nerve, as I told you, lingual artery. So the first part of the lingual artery you come across. Then the stylohyoid ligament, which we have already seen. Deep to anterior border, again you can see the lingual artery is present, the third part of the lingual artery. So nerve supply is by the hypoglossal nerve. Hypoglossal nerve supplies all the extrinsic muscles of the tongue. It is motor to the tongue except the palatoglossus, which will be supplied by the cranial part of accessory nerve. So action, it pulls the side of the tongue, as I told you, and it actually retracts the protruded trunk. Protrusion is mainly by the genioglossus muscle, which is also considered as the safety muscle of the tongue. Okay, so that is about the hyoglossus muscle, its relations. So next we will also quickly have a look about the lingual artery. So the lingual artery is actually a branch of the external carotid artery, anterior branches, external carotid artery. It is actually given in the carotid triangle. Okay, it arises directly from the external carotid artery or in common with the facial artery as the linguofacial trunk. So principal artery to the tongue, so main artery which is supplying the tongue, it is divided into three parts by the hyoglossus muscle. First part, which is from the origin to the posterior border, and second part is actually which is deep to the hyoglossus muscle, which runs horizontally. Then the third part ascends deep to the anterior border of the hyoglossus muscle. So it arises at the level of the greater horn of the hyoid bone. So first part, what happens as it commencement to the anterior border of the muscle, it shows an upward loop because it is looping around the greater horn of hyoid bone, so that the hyoid bone movement is not restricted. Okay, because the hyoid bone, the infrahyoid muscles will actually pull the hyoid bone downwards, and then the hyoid bone will also move upwards because the suprahyoid muscles and infrahyoid muscles act on that. So first part is actually the looping over the, it has an upward loop over the greater horn of hyoid bone, and the branch from the first part is the suprahyoid branch. Okay, the branch from the first part is the suprahyoid branch. So a small branch will be given from the first part. Then coming to the suprahyoid artery, so it runs along the upper part of the hyoid bone. Second part runs horizontally deep to the hyoglossus. So that is why the hyoglossus is cut here, so that to have a view of the second part of the lingual artery. So it is on top of the middle constrictor. So here you are able to see these transverse fibers. They are the middle constrictor muscle of the pharynx. So branch from the second part is the dorsal lingual artery. Okay, so the dorsal lingual artery supplies the posterior 1/3 of your tongue. The dorsal lingual artery supplies the posterior 1/3 of your tongue and adjacently the palatine tonsil. Okay, so palatine tonsil has also got other branches. Mainly from the facial artery, it gets its principal blood supply. But it also gives a branch to the palatine tonsil, dorsal lingual artery. Third part is deep to the anterior border of the hyoglossus muscle, and this is actually called as the deep lingual artery or arteria linguae profound. Okay, profound means the other name for the deep. Okay, so the third part itself is called as the deep lingual artery, which mainly divides into branches, and it is going to supply your tongue and your submandibular and sublingual salivary glands. So the deep lingual artery runs along the undersurface of the tongue, and it is accompanied with the lingual nerve. So lingual nerve is also giving branches to the anterior two-third of the tongue. So it anastomoses the deep lingual artery, anastomoses with the fellow of the opposite side. So as I told you, it gives branches to the, apart from the tongue, lingual, sublingual gland also. So the venae commitants, a pair of venae commitants accompany the deep lingual artery. A pair of venae commitants accompany the hypoglossal nerve. All these unite to form a lingual vein. All these veins, venae commitants, unite to form a lingual vein, which drains into the internal jugular vein. Okay, so in today's class we have discussed about the submandibular region, mainly the submandibular salivary gland, sublingual salivary gland, and the submandibular ganglion. Followed by that, we also actually discussed few aspects about the hyoglossus muscle and the lingual artery. So thank you very much for your patient listening.